and I am ready.
Okay, and you can see my presentation?
Yes.
Okay, great. All right, well, I'm Anna Six, and on behalf of Blue Cross Blue Shield of Michigan and Blue Care Network, I'd like to thank you for your time today. I appreciate the opportunity to discuss the 2023 Blue Care Network benefits that will be offered to you through the City of Detroit. This presentation is designed to help you better understand the Blue Care Network plan, the key factors to consider when making your choice, as well as give you some tips for better understanding and just how you can get the most out of your plan. So we're going to start off with what's new. This change was supposed to take effect as of 2022, but it was delayed to 2023. So federal policies now require that member cost share be printed on your ID card. So any members currently enrolled and newly enrolled will get a new ID card sent to them that will reflect this change. So you will now see your cost share on that card. So the Blue Care Network plan that is offered is the Healthy Blue Living Plan. The plan benefits aren't changing, so you're still being offered that same plan, which you're eligible for two different benefit levels with different cost share options. So the enhanced benefits are being the lowest out of pocket, and standard benefits have the higher out of pocket cost to you. So how do you qualify for the enhanced plan? So that decision's up to you. You're going to want to keep in mind that the decision you make is going to impact everyone on your contract. So if you have a spouse or dependents that are on your contract also, they don't have to complete the requirements. The benefit level that you qualify for will be the benefit level that everyone on your contract is enrolled in. So within the first 90 days of the plan year, you're going to need to visit your primary care physician who will complete and electronically submit the Blue Care Network qualification form. So you'll want to remember to ask for a copy of that form just so you can file it away in your records. But you'll want to note that you do not have to wait to January 1st to schedule that appointment. So you can start getting that scheduled now to ensure that you have an appointment within that first 90 days of your plan year. Next, you'll need to commit to work on 6 different healthcare measurements targeted by the Healthy Blue Living Plan, which we'll dive deeper into those in a minute. So within the first 90 days, you're also going to want to complete the online health assessment that's found by logging into your member account at bcbsm.com. In order to maintain enhanced benefits within the first 120 days of the plan year, if you're a tobacco user, you're going to need to enroll into the tobacco cessation program and actively participate until you quit. If your body mass index or BMI is 30 or more, you must participate in the Blue Care Network sponsored weight management program. So it's really all about commitment, and it's a decision that you make, and that's going to determine, the benefits that you're going to qualify for and your contract will qualify for the year. Okay, so our qualification form helps your doctor get a snapshot of your health related to the 6 high impact health measurements that you can control that significantly affect your health. So the health measure targets include not only tobacco, a body mass index below 30, blood pressure below 140/90, cholesterol LDL-C below target, blood sugar at or below target, and that any depression is in remission. So when your doctor completes the qualification form, they're going to give you a letter grade for each of these 6 health measurements that we just spoke about. So you'll get an A if you don't have the condition, or if your blood pressure, cholesterol, blood sugar, and depression all meet the criteria. You'll get a B if you have one of these conditions and it's not controlled, but you are actively participating in a treatment program to improve that condition. So you'll also get a B if you have a BMI of 30 or more, or if you're a tobacco user, but you're agreeing to participate in the Blue Care Network programs, the tobacco cessation and the weight management program. However, you will get a C if you have any of the conditions and you don't commit to or follow through with the course of treatment. Now, just to note, any C that you receive will cause everyone on your contract to be moved to the standard benefit level at day 91. So again, it's important to follow the Healthy Blue Living guidelines to maintain that enhanced benefit level. So just a quick recap, the step one is going to be see your primary care physician for that Healthy Blue Living exam. Ensure that they
I'm
complete
sorry,
that
Miss
form and get
Anna.
it sent in
I'm
to Blue
sorry,
Care
Miss
Network.
Anna. Miss
I'm
Anna,
sorry.
we can't see your presentation anymore.
Hmm, Okay. Let's see. I'm going to stop presenting and then try and share again. Okay. Can you see it now?
Yes, thank you.
Yes.
Okay. There we go. Okay. So just to repeat, step one, see your primary care physician. You'll want to have them complete that form and send it into Blue Care Network. You can make sure that it's completed by going onto your Blue Cross Blue Care Network member portal. Step two, complete that online assessment off of your member portal. And then step three is going to be to check your to-do list in your portal and enroll in the smoking cessation or the BCN weight management program if required. So now that I've outlined how a healthy blue plan or a healthy blue living plan works, I'll give you a high level overview of what your benefits are to ensure that you're familiar with them and understand the impact of your costs by being in the enhanced versus the standard plan. So before I do that, it's important to just understand the basics of your plan to get the most of it. So just going to go over some quick common words we're going to hear in your benefits. So your deductible is going to be the amount you owe for covered healthcare services before your healthcare plan begins to pay. The co-payments are going to be the fixed or flat dollar amount you pay for covered services. You'll generally see those with office visits, urgent care, ER, and you pay those up front. The co-insurance is going to be your share of the costs of a covered health service, usually a percentage. So you pay 20% while Blue Care Network picks up the other 80% of that service. The out-of-pocket maximum is going to be the most you pay in deductible, co-payments, and co-insurance within the year. And then, of course, the premium, and that's going to be the monthly amount that you pay to your employer each month for your coverage. So next we're going to dive into the actual benefits on the plan. So as you can see, there's going to be the enhanced benefit level and the standard benefit level. And the standard benefit level is going to be a higher cost share to you, with the enhanced having the $250 for a single, $500 for a family deductible. But if you're moved to that standard, you're going to see the $750 single, $1,500 family. You're also going to see the higher copays um, in the standard. So a 30 versus a 20, a 40 versus a 30 for specialists, 35 for urgent cares, and then both are going to have the 150 for emergency room visits. So you'll also have a higher coinsurance maximum on that standard benefit. So in the enhanced, you would see the 1,000 single, 2,000 family coinsurance maximum. However, if you're moved to that standard benefit, you'd see the 1,500 for a single, 3,000 for a family. Both do have the same out-of-pocket annual out-of-pocket maximum with that 6,600 for a single, 13,200 for a family. You will want to note that regardless of the benefit level you are on, you are going to have 100% coverage for routine health maintenance exams and immunizations. So the preventive care is going to be covered 100% in network regardless the benefit level. And the same goes for the hearing care. So it's going to be 100% of the approved amount once every 36 months on either benefit level. But it's just important to note that cost difference that you see. If you are able to maintain that enhanced benefit, you will see the cost savings in your cost share throughout the year. So this plan is an HMO plan. So that means you are going to have to select a primary care physician that coordinates your care. And that primary care physician is going to need to provide referrals and authorizations to ensure that services are medically necessary and appropriate for your conditions. This plan also works off on our PCP Focus network. So this is a network of local primary care physicians in the HMO network serving 20 counties in Michigan. So each family member on your plan must choose a primary care physician that is in the Blue Care Network PCP Focus network. So you can use the Find a Doctor tool on our website to confirm if your provider is in the PCP Focus network, as this can change yearly. And you will want to know if you are currently in this plan. If your doctor is leaving the PCP Focus network, you will receive a letter that's informing you of that information so that you do have the chance to find a provider that is in the PCP Focus network. So some of the key features of an HMO is that Blue Care Network has the Michigan's largest HMO. So we have access to, in all 83 counties, to more than 6,240 primary care physicians, over 24,000 specialists, and 133 Michigan hospitals. So although you must select a primary care physician that is in the PCP Focus network, you do still have access to the broad network of specialists and hospitals that are in our broad HMO network. So another important feature is to note is that your normal care is going to be covered in Michigan. However, you do have emergency coverage only when you're traveling. So across the country, across the world, you do have emergency service coverage. So when we think about the costs, we often solely think about how much is getting taken out of your check, each paycheck for the coverage. But you also want to consider the costs that you may see on a monthly basis when you're having services rendered. So the cost to actually use the plan, and then different ways that you can see a cost savings to yourself while using your plan. So an easy way to see the cost savings is by ensuring that you're staying in network. So this is the Find a Doctor tool that I mentioned. This is where you can confirm if your doctor is in the PCP Focus network for your primary care physician. And if you wanted to change your physician, this is also where you would use our Find a Doctor tool to find other physicians in your area that are in network. Again, as I mentioned, you'll want to use the PCP Focus network when you're looking for a primary care physician, and you can use our broad HMO network when you're looking for specialists that you may want to be referred out to if needed. So here are a few other ways that can help you see a cost savings throughout the year. You can select lower cost service locations such as online visits and urgent care. And I will mention where you can see these different options. You can make informed decisions on the prescription drugs you're obtaining. So finding different cost effective alternatives for medications that you may be taking, and take advantage of the flexible spending account that may be offered to you. So we will dive into these options a little more too. So, your primary care doctor is your best line of defense. But when the office is closed or you can't make it in, expert and network advice is still always on call. So, knowing where to go when you need care can help you save time and money. So, to learn about the different care options, you can take some time to visit bcbsm.com/find care. And that'll take you to the screen that you see here for your choices of care. And as you can see, you'll have access to a 24/7 nurse line, or also online visit care options, which are very convenient timing wise and cost wise. So we encourage you to take a few minutes to set up the Blue Cross online visit account. This account is different than your member portal. So it is a different account. You would have to sign up separately. You would need to visit bcbsmonlinevisits.com or download the mobile app from the Apple App Store or Google Play, and it'll walk you through the process to create an account for online visits. So as I mentioned, your plan does have the Blue Cross online visits, which is going to give you access to the board certified doctors through your smartphone or other device. So it's a really quick and convenient way to access your coverage. The medical visits offered on the Blue Cross online visits generally last about 10 minutes. And of course, the doctors spend as much time as needed with you, but we do see those generally just being about 10 minutes. Of course, it is going to be for more minor illnesses, pink eye, a rash, sore throat. the flu, things like that. Members will be able to have face-to-face visits with the doctor. They can also e-prescribe prescriptions to your pharmacy very seamlessly, in a matter of minutes. So you can do all of this from work or from your couch, and it just makes it an easy way for you to access your care. Doctors can be seen on demand or by appointment 24/7 for the medical services. Then another important aspect of these Blue Cross online visits is the behavioral health. So some members rather not go into a therapy office or just simply don't have the time to carve out of their schedule, even if even when we need it most. So using the Blue Cross online visits, you can schedule an appointment with a therapist when it fits into your schedule and when you're comfortable. So the therapy is available to adults and children aged 10 and older. It is by appointment only from 7 a.m. to 11 p.m. We also have psychiatry available. It is only available to adults 18 and over, and it's by appointment only. They do have some extended hours during evenings and weekends, so that does help. The initial visit is generally about 45 minutes, and when you're using the psychiatry and they do give you a prescription, you generally have the follow-up visits for that medication, and those last about 15 minutes. Okay, so you can also get cost estimates for more than 1,600 healthcare services around the country from doctor visits, lab tests, MRIs, and surgeries. So this is a really good way for you to weigh out different cost options for you based on different providers. So as you can see on this slide, if you're planning a procedure for 2023, you can use your member account to view estimated costs for those procedures. It will estimate costs that you can possibly project to, like physical therapy that you may need after a surgery. Um, you can compare the quality ratings of the facilities, but then also how much it would cost at different facilities. So you could compare having a surgery at Henry Ford versus Detroit Receiving and what the cost impact would be to you. So this is also a really great way for you to save money when planning those procedures ahead of time. Yeah, and again, this can be accessed on your app or your portal. Okay, so next I wanted to show you some tools just to help you understand and access your plan information. When you register for the Blue Cross member account and download your mobile app, you have access to a virtual ID card. So it's always at your fingertips. We know that's the first thing that anyone asks for when you go in for an appointment. You'll also have the ability to share that ID card. So if you have kids that don't keep track of their ID card, lose it, or don't have it with them, you'll have the ability to email or text a virtual ID card to anyone who may need it. So if you want to send it to your spouse, a dependent, you can do it via email to the provider's office if they may need it. So that's just a really convenient perk of our app. You'd also have some other advantages, such as seeing your deductibles, your balances of what you've met towards your cost share for the year. You can see all the claims that have been billed, how they've processed. You can review your benefit info, find a doctor, get the cost estimation. You can also see member discounts here. This is where you will also select your primary care physician. So you can go right in on the app and member portal and you can choose the physician that you want listed on file for your PCP. This is also where you can access our health and well-being programs, EOBs, referrals, and prior authorization statuses too. So Blue Cross Health and Wellbeing site is a person-first well-being platform that delivers unique, relevant experiences based on your individual interests and needs. So it's going to give you a personalized experience that allows you to focus on what matters most to you while being incentivized for achieving those goals. So it is an interactive platform that offers weekly webinars, interactives, and downloadable content that just encourages healthy behavior and lifestyles. It does also give you the ability to integrate and track your activity. So with your Fitbit, your phone, and it makes it more of a seamless process for you. So Blue Cross also provides a virtual well-being program, again, just to enhance that your well-being. It's at bluecrossvirtualwellbeing.com. And this is where you can register, download materials, and watch webinars and health coach videos. So every Thursday at noon, we do a short high energy webinar that covers a wide range of well-being topics to help guide you through your journey to a more fulfilling life. And these webinars change weekly. So if you have time just to tune in on your lunch, it's just a quick and easy way to get upbeat wellness information and tips. So next I want to talk about the Blue 365, which is discounts that you receive just for being a Blue Care Network or Blue Cross member. You have access to these exclusive discounts that do change from time to time. So currently some of the ones that are on there are 20% off Fitbits and free shipping at fitbit.com, 20% off products at reebok.com, 15% off all products in store and online at Better Health purchases. So again, they do change, so you'll want to keep checking for updated discounts. We have in-store discounts, which are obtained by just showing your Blue Cross or Blue Care Network ID card. And then there's also going to be online promotional codes that you obtain through the Blue 365 website. And that's how you get the online discounts. So another thing that's very popular that's on our Blue 365 discount is access to Tivity Health Fitness Your Way, which is a national gym membership program for $29 a month, which includes access to more than 10,000 gyms, including participating Anytime Fitness and Snap Fitness locations. So you can not only use participating locations anytime, anywhere, but members also receive up to 30% discounts on over 20,000 wellness services like yoga and massage therapy. So again, this is just one of the very popular discounts that people use on that Blue 365 site. So that's going to wrap up my presentation today on the Blue Care Network plan offering through City of Detroit. So we can go ahead and open it up to any questions.